Did you know that there are many myths surrounding the VA? Myths which may impact a veteran's ability to understand their benefits?
That is one of the topics we'll be discussing today, so stick around. It's time for the Sit Rep.
You have questions? We have answers. The Sit Rep is your trusted source for veterans benefits information with expert analysis and interviews with leaders from the field. To find past shows, podcasts, and other content, search hashtag the Sit Rep on YouTube.
Hello, everyone, and welcome to another episode of the Sit Rep. I am Marine Corps veteran Paul Corbett.
And I am Army veteran Mike McNamara. There are literally dozens of myths that surround the VA and VA benefits. And these myths often confuse veterans on exactly what they're eligible for their benefits.
That's exactly right, Mike. These myths, and I've heard from a lot of veterans, it creates a barrier. It keeps them from actually accessing the benefits in which they've earned and deserved.
Yeah, they think they're not eligible.
Yeah, and the first one I'd like to cover today is the fact that a lot of veterans who are healthy as a horse think that by using their VA healthcare benefits, they're going to take benefits away from a veteran who needs them, quote unquote, more than they do.
Yeah, I mean, that's, as we know, that's ridiculous. The VA is basically the more people who use, the more resources are added. So you're actually hurting your fellow veteran by not using VA healthcare, because then the VA is able to bring on more doctors, more equipment, based on the number of people that are utilizing the service. So it really doesn't cost anything. It doesn't do anything not to join VA healthcare. You just need to get out there and do it.
No, I tell people all the time that, is the VA a business? Not in the technical sense, but it does operate like a business in the fact that it's all about demand. If I'm making hamburgers as a business owner, if I'm making hamburgers and no one comes in to eat hamburgers because they want to save them for people that are hungrier than they are,
exactly.
I'm never going to sell a hamburger.
And there's not going to be a hamburger place.
No, I'll shut down. So I hear that myth all the time at outreach events when I'm talking to veterans.
And it's just, basically what we try to tell folks all the time is get enrolled, use it once a year. If you're healthy, if you feel like you don't need services, use it at least once a year so you stay viable in the system, and then it's there. If God forbid something happens, you get hurt, it's there for you to utilize. And that brings us to number two. And number two is one that we hear all the time too, that you have to have seen combat to be considered a veteran.
Yeah, that's it's tough because you're battling with, there's so many different organizations that are out there. There are state laws, there are federal laws, there's all different classifications as to what a veteran is and is not.
Right.
And it changes. There was a time where anybody that served, period, could get into the VA. That's no longer the case. Laws have changed that we have to abide by. And so, there's different priority groups. There's all different types of classifications that different veterans fall into. And it can be confusing. I hear this myth, and I know you hear it all the time.
Right.
More so from female veterans than I do from male veterans, which blows my mind.
Well, I think what's important to understand is that as long as you served honorably in either active duty or in the reserves, and there are some reserve component situations, but as long as you served honorably, you're a veteran. The country considers you a veteran, and the VA considers you a veteran for benefits. Now, as you talked about earlier, based upon your situation, did you go overseas? Did you not go overseas? Did you serve during a time of war? We have a lot of veterans now who served during the Cold War, basically came in post 1975 and got out of the military before, the first Gulf War, before, the 1991. I couldn't think of when that was. Before 1991. So in that, almost 20-year period, we had a lot of folks serve. So as long as you served honorably, you're a veteran and you can avail yourself of veterans benefits.
So the third myth that I'd like to discuss is the fact that a lot of veterans think that by utilizing one VA benefit, you're automatically enrolled into all the other ones. So if I have a VA home loan, or if I receive a monetary stipend from the VBA for disability, that I'm automatically in VA healthcare.
And the VBA one, the disability one, is very confusing because you have to go to a VA hospital to get your comp and pen, your compensation and exam to determine your level of disability. So folks say, yeah, I've been to a VA hospital, and so they think I'm good now. I'm there. I went to whatever hospital. I've already been there. I'm good. Not understanding that, unfortunately, it's not one-stop shopping when it comes to enrolling in various benefits.
Right. So it's the way that the VA is set up. So you have the VA as the umbrella, the Department of Veterans Affairs, and then underneath that are three different administrations. You have the VHA, which handles healthcare, the Veterans Health Administration. You have the VBA, the Veterans Benefits Administration, which handles basically
money.
Every other benefit that involves money.
Right.
And then you have NCA, which is the National Cemeteries Administration. And they handle all your memorial benefits.
Right.
And in some sense, it would make sense if the three of them talked. However, for every veteran's situation for HIPAA, for all sorts of stuff.
Right.
I mean, there's no reason why somebody at VBA should have access to your mental health records, or someone at NCA should be able to have access to your mental health records,
or your GI Bill,
or
whatever.
anything. So
I think the other thing too that's important to understand too is why they're kind of quote unquote stovepiped is there's different laws. So VBA falls under some different laws for disability than we do for healthcare, as an example. And then NCA is its own little entity because there's not a cemetery on every block. So I think that's important differentiation too. But I guess the most important part of all this myth is, check. Just because you showed up at a hospital one time to get checked to see if you had hearing loss for a disability claim doesn't mean you're enrolled in healthcare. Get out there, find out, check, and make sure you're availing yourself of all your benefits. The next big myth I think we should talk about, one that's really prevalent now in the past 20 years with all the deployments and that is that a veteran who served in the National Guard or the reserves is not eligible for benefits, not eligible for VA healthcare.
Yeah, it can be really confusing for a lot of individuals that are out there. Especially when you have multiple DD-214s,
right.
Like which one do I bring in and all that kind of stuff. The laws are always changing. I'll say that to every veteran I have ever spoken to, I mean, you're all in unique situations, and regardless whether you've applied before and been denied or never applied, you should apply. And laws are always changing, which means you should probably try again, give it a couple years and try again.
Right.
I mean, for the most part, most everybody that I know in the reserves or National Guard has been deployed at some point in time.
Especially if you've been in the Guard or reserves more than 5 years or something.
Yeah.
Right. If you served during the 2003 to 2014 or whatever time frame, yeah, more than likely you went at least once.
And not too long ago, also, Congress changed the rules, whereas an individual who retires from the reserve or National Guard qualifies for VA healthcare, whereas before there were people that served during that Cold War time
20 plus years,
20 plus times, retired and still can't use the VA because they were deemed not a veteran
because they didn't do the active duty deployment component, right? So you're exactly right. I think that's a good point. The rules and laws are changing all the time. Just real quick, like the whole Blue Water Navy thing around Vietnam, that's affected many veterans in the Navy and Marine Corps and Coast Guard that were supposedly not eligible under the old Vietnam rules. So it's important for veterans to keep plugged in and constantly checking to see what's going on.
And the next myth that I'd like to talk about kind of sort of ties into the whole National Guard and Reserve thing, and that's individuals that have TRICARE.
Right.
I've heard from veterans before that, I have TRICARE, so I can't use the VA.
Or I love my TRICARE, it's great, so I don't need the VA.
Right. But, I mean, you can actually speak to this more than I can. I stopped using TRICARE as soon as I got out of the Marine Corps.
Right.
but you've had it for quite some time.
Right. As a retiree, I also have access to TRICARE, and I use both. I think what's important is that as a using VA healthcare, I have no copays. My prescriptions are free. My eyeglasses are free. If and when I ever need hearing aids, those will be free. So there's a lot of benefits to staying plugged in on the VA healthcare side of the house. Some TRICARE packages, and it's all dependent on where you live in the country. So some TRICARE benefits are better than others depending on where you live, and the VA may be a more viable option for you. But what I tell veterans is use both, because the other thing that VA brings you, and I know we'll talk about this in a little bit, is the healthcare also plugs you into geriatric care and other benefits that TRICARE doesn't touch, especially end-of-life benefits or, nursing home or things, those stuff along those lines. So, yeah, it hurts no one, especially doesn't hurt the veteran to be a member of both and have the ability to use both.
Well, there's also certain advantages to VA that a lot of people don't think about. I mean, just the fact that you have a centralized medical record. I could be on vacation. I could be heading for a cruise out of Miami, and while I'm down in Miami, I'm like, oh, I forgot my medication, and I can just walk into the VA hospital there. They can contact Boston and confirm who I am and what I need and everything else, and I could pick up my prescription from the pharmacy there, and then I'm off on my way on your cruise. So it's those processes are a lot more difficult, I would imagine, in the private sector, because Dr. Hootenanny up in Boston doesn't have a medical system with someone down in Florida.
Well, I'll give you a good example. I mean, my daughter's in school in Pennsylvania, and so we have Blue Cross Blue Shield, and that's hard to shop around out in Western Pennsylvania. You have to be on the Allegheny health system, and to show up with, I got Blue Cross Blue Shield, that doesn't always work. And if you're in an emergency situation or something, you could be in real trouble. It's, basically in real trouble footing the bill. Whereas you said, I could be in Sacramento, California, and I fall down and need stitches or something. I can go to a VA emergency room. I've got my VA ID card. Boom, I'm getting care, and nobody's even thinking twice about it. They bring me up in the system, and I'm good to go wherever. I think the sixth myth we need to talk about kind of ties back to what we were talking about earlier with the reserve components, and that is enrolling in VA healthcare will affect an active reservist drill pay.
I've never been in the reserve, so I can't speak to that personally. However, just from reading, I understand that the only way that drill pay can be affected is if you're receiving some type of monetary compensation.
That's correct.
From the VBA.
Right.
But VHA healthcare, it does not affect you whatsoever.
Not at all.
Right.
You're exactly right. So if you're receiving disability compensation but still an active serving reservist drawing drill pay or annual training pay once a year, then you're correct. Then the two will offset. So, you will get your full disability, but that monies will come out of your monthly drill or your annual training paycheck. You're exactly right. Also affects healthcare in no way, form, or fashion. How much disability you're getting, or you're still actively drilling, does not affect your ability to utilize the healthcare side of the house. So that's important to understand, because the two are separate, and you can still come in and get, if you're looking to do some mental health counseling or something, you can still avail yourself of all those services, and it affects you in no way, shape, or form as a drilling reservist.
Right. And when we come back, we will be discussing the other 6 myths about VA.
Despite objections, in July 1948, President Harry Truman issued an executive order instructing the U.S. military to do this. Was it A, deploy nuclear weapons to Europe, B, downsize the United States Navy, C, integrate the United States Armed Forces, D, rebuild Japan after World War II, or E, help the British fight communist rebels in Malaya? The answer when we return. Despite objections, in July 1948, President Harry Truman issued an executive order instructing the U.S. military to do this. The answer is C, Integrate the United States Armed Forces. On 26 July 1948, President Truman issued Executive Order 9981. It abolished discrimination on the basis of race, color, religion, or national origin in the armed forces. The executive order led to the end of segregation in the United States military. Welcome back to the show. I think the next myth Paul and I would like to address is similar to the one we had about TRICARE, and that is a veteran's ability to use VA healthcare if they are using either Medicaid or Medicare. And the myth is that if you're using your VA healthcare, you can't use Medicaid or Medicare.
Yeah, it's not. I mean, they don't affect each other whatsoever. There are certain benefits to having VA. There's certain benefits to having Medicare or Medicaid. But they can all work together. A lot of people will use VA to pick up some of the cost, kind of, subsidize some of the things that they would end up having to pay for through Medicare or Medicaid. Nothing is free through Medicare or Medicaid.
Right.
I mean, you end up having to pay the bill somehow, some
Which
way.
is why there's always those commercials on TV for all the Medicare supplements that get pushed all the time.
Right. So, I mean, there's a lot of people that I know, once they get older and you have the options, you have to opt in, sign up for, and for different healthcare, provisions and what have you. I've had people ask, I have VA. Should I even bother signing up? I can't give you that advice. We're instructed.
I can't tell you.
No, we're instructed not to, tell people or help people through those situations.
What they should or should not do.
Right. But I do know of people that have used VA as some type of or some form of supplemental program.
Well, I think the big one, if I can jump in real quick, and the one we always kind of remind veterans of, and that is things, once again, hearing aids. I mean, you can come to the VA and get your hearing aids for free. You can get your eyeglasses for free. Depending on what level of VA healthcare you have, you can get your prescriptions for free. So if nothing else, it's a good supplement along those lines to pay for some of those big ticket items that Medicare may not cover 100%. Another myth we're going to talk about today is that the VA only considers your income when determining your eligibility for VA healthcare.
Yeah.
100%
false. Income is actually the very last thing that the VA looks at.
Right.
There is a laundry list, and I've said it before in other shows, and I'll say it again today, that every single veteran's situation is unique as to their enrollment and eligibility status. One veteran may be a former POW. Someone else may have been awarded the Purple Heart. Someone might have served in Iraq. Someone may be a Cold War veteran, but dropped a heavy box on their foot, and now they have 10% disability, and so they qualify. There is literally dozens of ways that a veteran can qualify for VA healthcare, and money is the last thing that the VA looks at.
Well, and just as you talked about it a little bit earlier, I mean, when you come into VA healthcare, you're assessed, and then you're put into what's known as a priority group. And once again, as an example, there's 8 priority groups with a whole bunch of criteria for each priority group. So you're exactly right. There's so many ways that a veteran can become eligible for VA healthcare. And as you said, if those literally pages worth of things don't apply, then the very last thing the VA looks at, and I think it's important to state, though, that the VA looks at it by law, and that is your income. And your income is based on your geographical region, basically.
Well, there's 2 different ones. I mean, you have one that's a national standard, and then you also have a geographical.
Right.
Because, I mean, some people, Boulder, Colorado is going to allow you to have more of an income than, say, Athens, Georgia, or something like that, because it's slightly more costly to live there than it is
in other places of the country.
It may not be. Maybe Athens, Georgia is really...
No, that's a great point, though. Typically, it's, different parts of the country are more expensive to live in than other parts.
Right. But, I mean, there's also if a veteran's been denied because of income, if your income changes, you should probably reapply. Or if you have increases in whether it's medical costs or dental or any of that stuff, then you should probably reapply. And not only that, but especially with times like these, I know we hear those words all the time, right? With times like these right now, there are hardship situations,
Yeah.
and the VA will consider those if you're in a dire hardship situation, because the VA, correct me if I'm wrong, but they look at your records from last year. How much income did you make in the past year? But if you have no income right now, that doesn't help you. So you can actually apply for a hardship situation where the VA will review what's going on in your current situation.
I think the other thing too, real quick, is we see this a lot, is if you were income ineligible, but now you're retiring and you're going to be on more of a fixed income, then we have a lot of veterans who approach us at that point and say, hey, yeah, I had this great job and I was making X, but now starting in January, I'm going to be retired and I'm going to be on a very fixed income making Y. Well, then it's, come on, let's reevaluate, let's take another look. And chances are you have a good possibility of now becoming eligible and being able to utilize VA healthcare.
Which, I mean, the next myth kind of rolls into this. We already kind of touched on it a little bit, and that's the fact that, if a veteran applies and they're denied, a lot of veterans think, well, that's it. I've been denied for life.
Yeah.
And that's actually
I was denied at 32. I'm never going to have the VA for the rest of my life.
No, it's not the case.
No. And we have touched on this already. 1, your income could change. 2, laws change every single year. Congress updates, changes some of the laws that determine eligibility criteria. We talked about it earlier, the Blue Water Navy Act, which just took effect this past January, and basically gave Vietnam combat era status to those members of the Navy or Marine Corps or Coast Guard that were stationed offshore, never stepped foot on the soil of Vietnam, spent all their time deployed offshore. And now that act is updated and covers them, and now a bunch of people. The other one you touched on, Agent Orange, opened up a huge realm of eligibility criteria for a lot of people. So you have to keep in touch in the sense of keep checking and understanding what's going on with benefits across the board, and then constantly, looking at the websites or what have you, to see what determinations they change all the time based on things that come about. And I'm sure it will be the same now for the war on terror, the Gulf War, Gulf War syndrome, all that stuff gets more studied and understood, then the criteria change for who becomes eligible under those issues.
Yeah, I mean, I'm not going to name drop any companies or anything, and I can't endorse them, but there are quite a few different institutions that I subscribe to their newsletters or what have you,
right?
And I constantly get emails or big button topics. Sometimes I'll even get text messages from different organizations saying, hey, this change just rolled out, alert, 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 so it's a good way to stay in touch with what's going on and what has changed.
And that kind of, we kind of just touched on this a little bit, but the next myth that we need to discuss is that so many people, especially on the younger side of the house, feel that the VA is only for older retired veterans. And how many times have we heard this? Hey, when I become an older person, an old guy or an older woman, I'll come see you, and that's ridiculous.
Yeah, I mean, you might think that, especially in New England. I mean, in New England, what's over 50? The numbers dropped a little bit. 54% of all veterans in New England are over the age of 65.
Correct.
So just by happenstance that we have a very old population with regard to veterans in New England, then a lot of people would think that, well, maybe the VA is only for older veterans because that's all I ever see there for the most part, right? But no, you're you're totally right. And I mean, if a younger individual wants to use VA or doesn't want to use VA, I mean, that's totally up to them. But I would venture to say that you'll probably have a happier life and a better quality of life in your latter years if you take medical care seriously when you're younger.
Yeah, I mean, everybody knows. I mean, guys are the worst to begin with. So we all know there's plenty of male veterans out there, especially if you're single.
Change socks and drink water.
Right. Yeah, the old military motto, drink water, change your socks. You know, we've talked about this in the past, too, that more than 90% of all healthcare decisions are made by the female in the relationship. Women tend to understand and are more intelligent about healthcare than guys ever are. Most guys, like you said, unless the bone's not poking through, I guess my leg will be okay, you know. Where, as you just said, if you plug in a little bit earlier time frame, then you can head off some things that, you know, and keep yourself healthy for years into the future.
Plus, I think people would also be really surprised at all the stuff that can be afforded to them in addition to healthcare. I mean, yes, VHA, we provide healthcare, but we also provide a lot more than just basic healthcare. So by not being plugged in the system, you don't have access to that stuff.
And just one more point on this. I know myself, when I started using healthcare, I was younger. I was, and didn't feel I had any issues, but, decided I'll take advantage of it. And ended up finding out that I did have some issues, sleep apnea being one of them that I just never paid attention to, just thought that's the way life was. I snored, so what? And didn't realize, how life-altering sleep apnea is. So the VA discovered that. Then the VA got me all the equipment to help me with that sleep apnea free of charge, and I probably never would have ever thought about it.
Well, that's actually a good segue, unplanned segue into the next myth, which is a lot of people think that the doctors are second-rate doctors at the VA, or it's you couldn't get a real job, so you become a doctor at the VA.
Yeah, you fall back on the VA.
Yeah, and you and I both know that's not true at all.
That's really, for those of us who work in the field, that's a very troubling myth in the sense that, help me out here. I want to say like 75% of all doctors in New England, medical professionals, 70% of all medical professionals in New England did some type of training at one time or another at a VA facility. Mm-hmm. And then just our affiliations. I mean, all of our hospitals in this area and so many hospitals around the country are directly affiliated with top-rate medical schools. So if you're in the Boston area, you're talking about Tufts, you're talking about Harvard, down in Connecticut, you're talking about Yale, and in Rhode Island, you're talking about Brown, and Dartmouth up in New Hampshire and southern Vermont. So, I mean, this top-notch medical schools, you have a lot of residents, you have a lot of doctors that are working in both. I mean, I'll give you a quick example. My wife was amazed. I had to have surgery and went through the Boston healthcare system to have my surgery. Mm-hmm. And she was amazed that to a person, all my doctors, were working not only at the Boston VA hospital, but they were also working at Mass General or Beth Israel or, really internationally known top-ranked hospitals, and they were doing double duty, and she was amazed by that, and it gave her a good feeling that hey, you're talking about some of the best top-notch specialists in the world are also coming to the VA and providing care to veterans.
Yeah, I mean something else that people don't realize either is that multiple doctors at the VA have won Nobel Prizes. And that, the VA has invented the nicotine patch.
I was going to say, this is your favorite. You love to talk about this.
But I mean, they invented the pacemaker. They invented the procedure for the first liver transplant and the shingles vaccination. All that stuff is created by the VA, and you don't get that type of ingenuity and innovation from a second tier hospital system.
No, I mean, correct me if I'm wrong, but like the most medical research in the country, or the second most amount of medical research in the country, is done by the VA.
I don't know the stat on that.
I want to say it's the second largest medical research is done by, all the VA hospitals nationwide.
I mean, I know the last time I looked at the amount of money that we were spending on research, there was nobody spending more than we were at the time in New England.
Right.
I don't know if that's changed, but the amount of money that we spend on it's astronomical. It's a lot.
And, agencies all over the country depend on the VA. As an example, I mean, the NFL used information for all their head trauma issues over the past decade or so. All that research came out of a Boston researcher who was doing brain and head trauma stuff related to roadside explosions and TBIs that people had. And there was a parallel, and the NFL was able to basically draw a parallel that the same thing was happening to their players, head trauma that was happening to service members, who are involved in various issues and accidents.
And so we've got one myth.
We have one myth left, and one myth that we're going to discuss today anyways. There's so many more myths, but for today, and it kind of ties back into what you just talked about with the doctors. And another one that's just crazy that we all shake our head is that there's a belief out there that the VA has all hand-me-down equipment. So that, once a quote-unquote real civilian hospital no longer can use their X-ray machine, they get a new X-ray machine, they hand down the old X-ray machine to the local VA hospital, and that's what we use. And we both know that is so crazy to even think about.
Yeah, no, it's at least I know for a fact here in New England, we have the best equipment that you could possibly have. I mean, people, even our processes. I mean, I'm not going to name drop any hospitals or any nurses and doctors that I've spoken with, but especially with the pandemic that happened, there are individuals from other parts of the healthcare sector that came in to assist the VA with providing care to veterans, and they came in and was like, wow, like you guys your processes are more streamlined, more innovative. I can't believe you guys have this type of equipment. I can't believe how easy it is to order stuff for veterans. Like you have access to everything. I mean, even I did a podcast with Craig Hall, and he was talking about, with the prosthetics department, there's like, this guy's not even a vendor, but he invented something out of his own garage that we think would work really well for you because you want to get back into doing extreme sports and this and that, whatever. And they went out of their way to get this guy vendorized and work with him to get the prosthesis that he needed in order to improve his quality of life. And the bounds that VA goes to, not only with the X-ray machine that they have in their clinic, but everything else is just, it's incredible.
I'll give you another example too. I know of a hospital here in New England that had the top of the line CAT scan, the most up-to-date CAT scan machine in the entire state, to where other hospitals with through agreements were sending some of their really complicated cases over to this VA hospital in order to utilize that CAT scan machine because of the definition. And I'm obviously I'm not an engineer, but just because of the level of imaging that CAT scan gave, and that was in the VA hospital. It wasn't anywhere else in that state. So yeah, you're exactly right. We both know, working in the system, of the millions of dollars that the VA invests every year on top of the line, not only equipment, but I think medications as well. I mean, I know for the longest time, the VA was the number one provider free of charge to their veterans for the Hep C, that really expensive
The boosters.
The really expensive line of drugs that you could take in order to battle Hep C. And, obviously the VA was providing that free of charge to their veterans. So, there's so many things, as you talked about, from prosthetics to top of the line hearing aids, to just the equipment that the doctors and nurses use on a daily basis, to the drugs that are available to be prescribed for veterans. And I think you hit on an interesting point too. The VA being an all-inclusive healthcare provider, doctors and nurses and practitioners aren't as concerned with ordering tests and ordering procedures as they may be in a civilian environment, where there's a different business dichotomy as far as how things go. Here, whatever the veteran needs, we need to get it and take care of it and make sure that he or she is taken care of 100%.
Exactly true. And that's all of our myths. 12 of the ones,
at least
that we
12
hear.
of them. Yeah, the 12 top ones that we hear all the time.
And when we come back, we will be doing this month's issue brief, where we take a particular benefit and break it down to the bare bones.
The first two names inscribed on the Vietnam Veterans Memorial in Washington, D.C. were not combat soldiers, but rather these professionals who were helping the South Vietnamese. Were these professionals A, United Nations aid workers, B, American physicians from Doctors Without Borders, C, American embassy personnel, D, American military advisors, or E, agents from the CIA? The answer when we return. The first two names inscribed on the Vietnam Veterans Memorial in Washington, D.C. were not combat soldiers, but rather these professionals who were helping the South Vietnamese. The answer is D, American military advisors. The earliest date of eligibility for a name to be included on the memorial is November 1st, 1955, which corresponds to President Eisenhower deploying the Military Assistance Advisory Group to train the Army of the Republic of Vietnam. The first two Americans military advisors to die in Vietnam were Major Dale Buse and Master Sergeant Chester Ovind. They were killed by Viet Cong guerrillas on 8 July 1959. As Paul and I discussed earlier, there are advantages to utilizing both VA healthcare and Medicaid. In this episode's issue brief, Paul is going to tell us what those benefits are. Paul?
Kind of talked about it a little bit earlier. I didn't really want to get into it because it's for the issue brief. But one of the big advantages to VA over Medicaid is when you get into long-term care or end-of-life care, any situation in which you find yourself in a professional facility for, I think, more than 30 days.
Okay.
Reason being is that this doesn't happen in every situation, but it does happen in a lot of situations, whereas the state wants to try and recoup the cost of providing long-term care or other services to the individual who is utilizing their Medicaid benefits. And the state has the ability to put a lien on or seize the property of that individual who is utilizing the benefits once they have passed away. So there are quite literally family homes that have been, in the family's name for generations that end up going to the state so that the state can sell it off and then recoup some of the costs for that care. However, major difference, the VA doesn't do that. If the VA spends $1 billion, you'd also be the most expensive patient the VA has ever had. But if the VA were to spend $1 billion on Michael McNamara for your end-of-life care, the VA is not going to come to Michael McNamara's family and say, you need to help us flip this bill. That entire bill will be absorbed by the VA, and there will be no cost to the family.
So let me understand this then. My dad, as an example, is on Medicaid. Mm-hmm. And we're at that point where he needs long-term professional care. And we wish to do that utilizing his Medicaid benefits. So, the state of whatever is going to help subsidize the cost of that care. He has that care for however long. And then when he passes away, then the state has the legal, lawful ability to come to us and say, okay, now it's time for you to help us or help pay back the cost that we provided your loved one. And they can put a lien on whatever properties or whatever was in my father's name, and we have no recourse. We've basically made a pact with the state to take care of my dad. Now it's over. Now we got to pay.
Yeah, I mean, as not every state is the same, because Medicaid is a state product. So I would highly advise anyone that is utilizing Medicaid or looking at Medicaid for end-of-life, long-term, residential, in-home care, whatever, the really expensive stuff. I would really, really investigate that and look into it because there are options that exist through the VA that are at no cost or very small cost, and it's capped. So even if you hit a certain number, say it's, I don't know it off the top of my head, but say if you hit $2,800 worth of medications and that's the cap, then all your medications after $2,800 are free.
Right.
Even if you have a copay, you no longer will have a copay after that.
Once again, this comes back to all the myths and everything we've talked about today. And the bottom line to all of this is, if you're a veteran or your loved one is a veteran, you need to get out there and figure out your benefits, your eligibility for benefits. I mean, you just brought up in the issue brief another great example. If grandma, grandpa, dad, mom, whoever served this country and served honorably, then you shouldn't be placing your family home in jeopardy to get them the care they deserve. As a veteran, the care is out there already for them.
And not only that, but if the individual who is watching this is a veteran, or you are the loved one of a veteran, and that veteran is on Medicaid, they automatically qualify for VA health care as long as they served honorably and served to whatever term. There's different allocations of time that you had to have served prior to 1980, post 1980, all that kind of stuff. But in a general sense, anybody that served honorably and is on Medicaid automatically qualifies for VA healthcare. So there's really, honestly, no reason to not, if you are on Medicaid, to go ahead and speak with the VA and get enrolled in the VA healthcare.
It hurts nothing. No. And I know myself personally, I have directed a number of people down that road that, and a lot of times it's just a conversation you're having with somebody, and that, oh yeah, I'm taking care of my dad right now. He's got Alzheimer's. It's not good. My mom can't do it anymore. So we're going to have to, did your dad serve? Yeah, he served in the Navy right after Korea or something. I'm like, have you talked to the VA? Have you looked at your VA benefits? No, my dad we never did that. I'm like, well, let's get started, because
I mean, the VA does an exceptional job working with families and working with veterans who have dementia, Alzheimer's, and stuff like that. The people that work in those units are phenomenal. They're phenomenal people, and they do an excellent job. And I've personally assisted 2 families with getting a loved one into that department or to get that care in a residential facility. And both of the families just remarked at how wonderful the whole experience was, and how much better the quality of life of their loved one was while they were there.
Yeah, it's so important. So bottom line of this episode, don't listen to hearsay. Get online, get on the phone, whatever, and discover what you're eligible for. Utilize your benefits. Don't listen to the barracks lawyer, your buddy, who says, oh no, I've heard this. Find out for yourself and take advantage of your benefits. Well, that's today's show. Thanks for watching. And as always, we want to thank the VA New England Healthcare System, who makes the SITREP possible.
And if you're looking for additional content, whether it's other shows, podcasts, or clips, or anything, you can do so by searching hashtag #TheSitRep on YouTube. And as always, to all of our brave men and women who have or are currently serving,
Thank you for your service.